How's everybody this morning? Can you see me in my loud dress? You know, I'm going to begin this presentation for thanking Dr. Wilkins, Consuelo Wilkins, for finding me and inviting me to share our journey through big data here. I almost didn't make it because I kept missing the emails, and then I got a forwarded email with the invitation. It's like, oh my God. And when I saw the roster of people who are going to be here and some of my old community partners from Chicago and my Corey family, it's like, I got to be there. So here I am. Very happy to be here. I'm going to begin this journey to share that, you know, my name is Regina Greer Smith, and I have a one-person organization called Healthcare Research Associates, and I'm the president, CEO, chief engagement officer, and I call myself the engagement activist because I'm the child of some very strong civil rights parents and family. Grew up in Chicago in Lawndale back in the early 50s, so I'm going to kind of tell my age. I'm applying for Medicare next year. I sat at the table with some great African-American Catholics, which we're called the 3%ers because there ain't that many Black Catholics here in the country. And I want to say that because I'm working very much with my brothers and sisters in Chicago around the country, but my real strong advocates and partners are faith-based communities, a group of African-American pastors that I've been working with for 20 years in the South Side and South suburbs of Chicago called the Southland Ministerial Health Network. And when I got called into service with PCORI back in 2012, the first group that I spoke to about PCORI was the Southland Ministerial Health Network, because I found it kind of hard to believe that there was an organization funded by the Affordable Care Act with authorizing legislation that wanted patients to be the center of research, and there was a strong focus on African-American communities and communities of color and underserved people, and it's like, yeah, right. But I thought, you know, maybe this is something that we need to look at because we have been talking about healthcare for a long time, and I told the pastors, maybe we need to look at this research thing because this is something that might help inform us and help us talk about why we are and why disease is such a burden for us. So, okay, a burden for us. So, I'll keep talking. So, and I said, in fact, you guys could be the pastors. Okay, okay. I'm gonna. There you go. Okay, that's okay.
I just want to make sure everybody can hear you.
Okay.
On the
you couldn't hear
go-to
me?
meeting.
Okay.
You need a microphone.
Okay, I'm okay now? Okay. So I'll continue. So I told the pastors, I said, you know, we've been doing health fairs. We've been talking about our burdens in our communities. But now PCORI says that we can design research and participate in research. Maybe we should look at this research and start getting involved with this. So I said, you could even be the pastors for PCOR. They like the name. We made a non-for-profit organization about it. So what we're going to talk about today is, I'm going to tell you about our story from the South Side and South suburbs of Chicago and how we collectively developed a method to find out what our data was, learn about how to collect our own data and share with our communities, and to determine how we can make data our own so we can find out the topics and questions we wanted to learn about how we can have a better health journey. So we developed our program, Passes for PCOR. We made it a 501c3 with the help of Northwestern's Alliance for Research in Chicago Communities. They funded us with a seed grant. So we developed our non-for-profit, and we began the journey to find out who in our faith community wanted to be part of our program to develop. We hadn't developed it yet. And then we were fortunate to be connected with a great researcher that Melvin just mentioned, Dr. Rebecca Johnson at Northwestern. We actually sought her out. She didn't know us, but we were looking for our own research or somebody who could build a relationship. So we started that. So we achieved this by partnering with researchers from an academic health center. So they didn't come looking for us, we went looking for them. We wanted to foster relationships to build a robust research infrastructure in our community, and we wanted to build capacity for faith-based communities to engage in health research. So a couple of photos. The one on the far left of this, and in the front is Dr. Rebecca Johnson, and around the table are our pastor leaders from 20 churches in Chicago. Southland Ministerial Health Network made up the Pastors for Peace Corps organization. In the middle, a group of me with a group of first ladies from Victory Christian Church. We did our first patient engagement cluster. We wanted to see if we could have conversations in the churches about health care. So we did that. On the far left, there was a cold February of 2014 when the pastors decided they actually wanted to begin the research journey. So we huddled around the table and they decided among themselves who was going to be the leader or the chair of the program. The chair turned out to be Bishop Simon Gordon, senior pastor of Tri-Stone Full Gospel Church, and then Reverend Pastor Walter Turner of New Spiritual Light Baptist Church in South Shore. They are the chair and co-chair. And you can see me far off on the left in that blue sweater. I was nervous, but waiting for them. They made their own decisions. And the other pictures are when we're just sharing and talking about how we're going to really figure out how to do this research. And that picture, me in the red sweater, as you go through these pictures, you'll see my hair change. I had lots of different hairdos. I've grown hair and lost hair, but it turned out all right. This is a couple of us, board members of Pastors for Peace Corps at the, we're here in D.C., I forgot where we're at, but Bishop Simon Gordon on the left. Dr. Pierce Davis, she became, and she was appointed, the executive director of Pastors for Peace Corps. That's me in the middle, and Pastor Turner on the left. We're in D.C. working with an organization and sharing Pastors for Peace Corps. And that's our official logo and our button. This slide will show you the organizations and the board members of Pastors for Peace Corps. So we're faith-based, community-based, two academic medical centers, and a policy program, a policy institute. We make up the board for Pastors for Peace Corps, and we do the guidance on how to develop our programming and just really making the decisions for the program. Dr. Rebecca Johnson is with the Bueller Center of Northwestern, and she's our lead investigator. More pictures, and one of the things that we did to begin our journey, we had our first community day of research engagement where we invited community members to a church in the south suburbs, Victory Christian International, to talk about research and what research would actually look like in our community. So we did some exercises, we did some facilitation, we did some table exercises. What's most important in the lower left-hand picture, we actually provided certification for human protections training for all of the pastors in each of the 20 churches. That was facilitated by the Alliance for Research in Chicago Communities. So all of the pastors got their IRBs. Very, very important. They still have those. That was the beginning of our research journey. You know, get the pastors and the communities buy-in and get our pastors certified. We did that with a community event. Now, our journey began in September 2015. These were all of our research ministry ambassadors, and we named them, we gave them that title because our plan was to overlay research training in each of the health ministries in the 20 churches. So we entitled our ambassadors Research Ministry Ambassadors, and that's something that we kind of tagged, and we kept that training. So this is our beginning of our research training, our first picture, September 2015. And there I am in the middle with brown hair. Okay. I'm going to share now our roadmap. We developed a 5-module curriculum to train our research ministry ambassadors how to get involved with research and specifically big data. So today I'm going to talk about our journey through our module 3, step 3, which is big data. For step 2, we got all of our research ministry ambassadors had a 1-day training in human protections training. So all of them also received their IRB training in addition to the pastors. That was important because they were going to do data collection. And we all know in order to do data collection and research, you got to be certified. So everybody received their certification. I want to thank Jen Brown's here with the Alliance for Research in Chicago Community. Thank you very much. They came to our church, Tridestone, and they trained us that full day. So in order to do our data collection, we had to get certified. So we're going to talk about step 3 today, big data. So our goal in our big data training, we had 3 goals, or 3 goals. First, our first goal was we needed to know where the big data about health outcomes and related factors comes from and feel confident engaging big data projects. We had to learn what big data was, where it came from, and how do we kind of transition that to learn about our own data. Our second goal was we would have to develop a survey to identify the health conditions and factors which are priorities in our faith community. So in order for us to get involved with the research, we had to determine what were the priorities in our communities and where did that data come from, especially in our faith community. Then goal C, we had to have the tools to conduct a survey on health conditions and factors impacting our faith-based community. So we were on a journey to also develop our own surveys so we can determine how to collect our own data. So that's one of our training classes there, Tridestone Full Gospel Church in Beverly and South Side of Chicago. Okay, so goal A, this is Dr. Johnson preaching to us about big data. Know where the big data data about health outcomes and related factors comes from and feel confident in engaging in big data projects. So what we did was Dr. Johnson and we all got together and we looked at some survey instruments and some reports. And one of the ones we used was the American Community Survey. We shared that with our research ministry ambassadors so they could get the big picture of big data. And then also how and where data collected and how survey responses are made. So we use those tools. We use what was already out there and what people may be already familiar with to really get them going on how to learn about big data. And what is big data used for? Show them scorecards, overall health outcomes, and health behavior. And then we looked at the City of Chicago data. We pulled down reports and shared with them how the City of Chicago collects data on a community-wide level and how it's measured to determine Chicago's health scorecard. And then we showed them specifically the zip codes that we work with, because what we did, we also did surveys on each of the church's zip codes and the health burdens and disparities in each of the zip codes in Chicago. And then we also pulled out, we call the PCORI style big data. We looked at some of these current PCORI projects going on in Chicago. We use Sirius health stroke program that's going on between Northwestern University and Rush, and showed them how they're using data from Chicago to develop a PCORI project. Then we also looked at PCORI's patient-powered research network. We told them how patients around the country and in Chicago are actually joining these patient-powered research networks, PPRNs, that specifically invite patients to join who have that particular disease burden and learn and get information from them as well. So we looked at the Healthy Heart Alliance, and there's a large pragmatic study called Adaptable now that really manages that. So we showed them that, and we looked at the About network. So going through this journey, a couple of our research ministry ambassadors actually joined these big data projects and the PPRNs. So then our second goal was to develop a survey so we can share it with the community. We used a couple of tools to really outline the different disease burdens and chronic conditions around, that are happening around, the body. And then we made this little person, and we did a couple of exercises on what diseases impact certain parts of the body so they could be familiar with where burdens lie in the human body. And then we developed some survey templates, so that people can understand when they share with their communities who was doing the surveys, the health conditions that are important to them, health factors and the demographics for each of their faith communities. So these are some of the survey instruments. Between our classrooms in services, which was every other month, we had exercises for them to do between the times. And there was 3 of us researchers and advocates, we served as mentors. We went to the churches and we supported them as they were developing their surveys, you know, learning to do the messaging, et cetera, so they can do it in the communities. It's one thing to do with thing in a classroom, but to really go to your churches and work with them is a different experience. So we supported them with that. One of the things that we had to do was help them to develop some messaging. You know, even though we shared Pastor P Corps, but we had to deliver a message for the churches. But first we had to tell and share who Pastors for P Corps is. You know, we are conducting a survey because the message they wanted to deliver, you know, who can take part in it, you know, anyone who lives in the community and who prays in the southern and south side of Chicago can be part of the survey. You didn't have to be a church member, but anybody in that community, in that church's area can take the survey too. And then what was very important, we wanted to let them know what was going to be happening with the data. That was extremely important. And then some of our the demographic exercises and parts of the survey. And then we did a exercise on the health burdens for a particular area. For many of our community people come from Harvey. I live in the community, or lived in the community right next to Harvey. So we demonstrated how Harvey fits into the full plan and scope of health data in Illinois. Okay, survey factors, we developed this so the research ministry ambassadors can deliver to their congregations, and then learn how to develop the survey. After you develop the survey, then they went into their churches, and during Sunday service and during Bible study and any other time the community people are in the church, you know, take a survey and deliver it. So we collected about, I think, 638 surveys, which really was not, I think was pretty good first time around. These are the survey instruments. And we also made sure that our picture was on the survey so they could be familiar with us and the other research ministry ambassadors for the program. And then, you know, they connected with us mentors. We went and helped them to deliver the survey. They delivered the surveys, but I did the messaging. I had some great experiences in going to the pulpit, delivering surveys. I had to first be vetted and approved by the deacon to share the information and the surveys, while the research ministry ambassador actually delivered the surveys, and I did it was supposed to be a short sermon. And I've learned that in many of the churches, when you hear the organ, you're supposed to stop. Me being a Catholic, when you hear the organ, that means you're supposed to sing. So I got the 2-minute warning a lot. And then I actually had a pastor who said, you know, Sister Greer thinks this church belongs to her. But we're glad she's here. But when you hear the music, you're supposed to slow down. So I learned that lesson. But, you know, pastors are, you know, lovely people. They really helped me a lot, and I learned a lot too. So we disseminated the surveys to our faith tradition, and then we also had an evaluation for it. So these are the report cards that are the end results of our almost year-long journey from learning about big data, developing our surveys, and delivering them. We got our scorecards. And we use this information not only to share, you know, amongst ourselves, but our congregations. Each the research ministry ambassadors got an individual scorecard to share with their pastors and their churches and their communities, in addition to a Pastor for P Corps score-wide card. So they got a big one with everybody's information gathered, and then there's individual. So these are some of the results of our year-long journey. And what was one of the questions that we asked our participants was, what are the resources your faith-based community needs to address the health conditions and factors you identified? And the most important thing was education, programs, and research. You know, places and facilities that's needed in the community. You know, they considered neighborhood factors, information and communication, access to affordable health. They need finances, they need people. So this is one of the important factors that they said was priorities for the community. So then we had a graduation in October of 2016. You know, there's me on the far right again with Bishop Gordon. He gave me a certificate of appreciation, and I cried like a baby. I mean, it was very emotional, not to get just the certificate, but for the pastors to really embrace research. But because, you know, and I'll tell you, for researchers, for Corey is maybe just a source of funding. For our community, it was a lifeline, and I will share that. This is the first opportunity we've had to be able to do research without fear, and Corey really brought us on that journey. So we did this work under the Eugene Washington Engagement Award in 2015, and we were awarded another award in 2017 to disseminate our faith-based training, and it's on Corey's website, so we're sharing it freely. And Pastor Barbara and I were taking selfies and stuff, you know, during the graduation ceremony. So this is our formal graduation picture. This is where we began in Tri-Stone Church, and all of the research ministry ambassadors who were certified during that process and who delivered all of the faith-based training. So that's my journey. I hope it helped to really share how community people just, you know, they can learn how to do, we can learn how to do big data so that we can share with others, and so they can learn about us and really help us with research. What was important for us is that in this journey, researchers were looking for us, we were looking for researchers. So we really went out on faith to say, we're going to try this and really activate what Corey had promised and research done differently. And it was really meaningful for us because we had researchers in the past come to the community and they left nothing. So we got our own data, we did it our own way, and now we can share it with the world. So thank you for listening.